Ricky. I'm going to be your student nurse today. What is your name?
Aaron. Very nice to meet you, Ricky.
Nice to meet you, Aaron. I'm going to go ahead and wash my hands before I do anything else, and I'm going to shut the door and close the curtains to provide you with some privacy. Okay, Aaron, how old are you?
I am 20 years old.
And when's your date of birth?
12/10/1995.
Okay, so you do seem 20 years old. Patient seems age you stated. Okay, how you feeling today? Any
I'm
issues?
feeling pretty good, Ricky. Really, really good.
Okay, your mood seems adequate. You seem calm and collective. That's good. I don't see any obvious signs of illness. You seem pretty healthy from my standpoint. Are you allergic to anything?
No, not at all.
Are you in any kind of pain?
No.
And what was your name again?
Aaron.
Do you know where you're at, Aaron?
I'm at the hospital.
Do you know what month it is?
April.
Alright, patient is alert and oriented times 3, so that's good. Okay, today I'm going to be doing a head-to-toe assessment on you, okay? Okay, we're going to go ahead and get started on that. First, I'm going to inspect your hair and scalp. Do you mind if I touch your head?
Oh, go ahead.
Okay. Alright, I'm not feeling any lesions, no bumps. You have black hair. Scalp's warm. Okay, good. Next, I'm gonna inspect your eyes, okay? Your pupils are around probably 3 millimeters. Any problems with your eyes at all?
No,
Any
not at all.
discharge lately? Okay, good. I'm gonna shine a light in your eye. Just look at me, okay? Good. Alright, pupils are round and brisk reaction to light and accommodation. That's good. Next, could you open your mouth for me? I'm gonna take a look in there. Shine my light in there. Oral mucosa is pink and moist. Don't see any problems with that. Teeth are white, good. Can I see your gums? Gums look pink and moist, nothing wrong there. Open wide, say ah. Uvula is midline, your tongue is midline, good. And I'm not seeing any tonsils. Did you get them removed at all in your life?
Yeah, when I was like 8 years old.
Okay, that makes sense. Okay, thank you. Next, we're going to go ahead and look at your neck. I'm going to start by palpating your carotid arteries. Any pain or tenderness there? How about this side?
No, I don't feel any pain at all.
Okay,
No.
next, I'm going to auscultate your carotid arteries using the bell side of my stethoscope. Deep breath. Deep breath. Good, I don't see any signs of bruises or anything like that. That's good. Okay, next I'm gonna take a look at your face. Your nose is midline. I don't see any facial drooping at all. Could you smile for me? Okay, good. Could you puff your cheeks? Alright, and then slowly let out the air. Alright, cranial nerves 5 and 7 are intact. Okay, next we're gonna look at your upper extremities, so could you hold out your arms for me? Okay, I'm just gonna use the back side of my hands and feel your color, temperature, and moisture. Arms are warm bilaterally, dry bilaterally, and white. Fits your ethnicity. Okay, good. Next, I'm going to check your capillary reflow, so could you pull out your hands? Okay, we have less than 3 seconds. That means your circulation is good, okay? Next, I'm going to have you grip my hands and squeeze them as hard as you can. Test your muscle strength. Good, you have good upper body strength. You work out at all?
Yeah, thank you.
Nice. Okay, next we're going to check your brachial and radial pulses bilaterally. Brachial pulses +2 bilaterally. Radial pulse for thumb side over here. Those also feel +2 bilaterally. Okay, thank you. Can I take a look at your nails as well? Nails seem healthy, you don't bite or anything. I don't see any clubbing of the nails at all, so that's good. Okay, next, if you want to have a seat, I'm going to listen to your lung sounds. Actually, I'm going to start with your heart sounds first, okay?
Yeah, that's fine.
Okay, I'm going to describe the location of each valve before I actually listen to them. First, we have the aortic valve right here. And this is the second intercostal space, right sternal border. Then we have the pulmonic valve, and that's the second intercostal space, left sternal border. Then we have the herbs, and that is the third intercostal space, left sternal border. Then we have the tricuspid valve, which is the fourth intercostal space, left sternal border. Then we have the mitral valve right here, and that is the left mid-clavicular lining. Okay, let me go ahead and listen to them now. I'm going to start by using the diaphragm going down, and then I'll go back up with the bell side of my stethoscope. And the mitral valve is where we'll be taking the apical pulse for 1 minute, even though I'm not going to go for a full minute. All right, I'm going to go ahead and use my belt and go back in the opposite Z pattern. Okay, I didn't hear any murmurs or anything like that. You've got a healthy heart. Next, I'm going to check your lung sounds. It's going to be 10 spots anterior, 10 spots posterior, and also I'm going to listen to them laterally. Then I'm going to go down after each spot and then across to the neighbor. All right, there are 10 spots on the front. I'm going to check the posterior lung sounds. Okay, could you lift up your arm for me? Thank you. Other arm, please. Okay, good. I didn't hear any adventitious lung sounds. So that means you have some healthy lungs. Okay. I'm also going to note that your antero-posterior angle is about a 2-to-1 ratio, so that's good. Nothing wrong with that. Next, I'm going to check your costovertebral angle. Let me know if you're in any kind of pain when I do this, okay?
No pain.
Any kind of tenderness or pain? Okay, good. Thank you. Next, if you want to lay down for me, I'm going to inspect your abdomen.
Which way are we? This way.
First, I'm going to inspect, look for scars and any abnormalities. Then I'm going to auscultate, then I'll palpate, and then percuss. So I'm expecting the abdomen for any scars or anything. I don't see any scars, lesions. Skin is warm. Okay, next I'm going to auscultate, starting with the right lower quadrant. In the right lower quadrant, we have the cecum, appendix, and the right ureter. Next, I go to the right upper quadrant. Right upper quadrant, we have the liver, gallbladder, and duodenum. Next, I'll go to the left upper quadrant. The left upper quadrant is the stomach, the spleen, and the left lobe of the liver for the organs. And lastly, we have the left lower quadrant, and that would be the sigmoid colon, the left ureter, and part of the descending colon. And these bowel sounds are present. I didn't hear any abnormalities, no adventitious bowel sounds. Okay, good, thank you. Next, I'm gonna palpate, and let me know if you're feeling any kind of pain, okay? No pain at all?
No.
No tenderness?
No.
Okay, last thing I'm gonna percuss. Let me know if you feel any pain or tenderness.
Just soreness.
A little soreness? Maybe from a workout or something?
Yeah.
Okay. Okay, next, I'm gonna have you get up. Umbilicus is midline. I'm not noting any jugular vein distension when the patient sits up, so that's good. Next, we're gonna test the lower extremities, okay? So you wanna lift up your pant legs and take off your shoes for me? Okay, I'm gonna use the back of my hands and inspect his legs. Legs are warm bilaterally. Hair distribution is symmetrical bilaterally. I'm not feeling any lesions, any bumps. Okay, good. Next, I'm gonna test your muscle strength. So could you raise up on your feet? Good. And then down like a gas pedal. Good. Could you take your socks off for me now, please?
Both of them?
Yes. Gotta do it bilaterally. Okay, first I'm gonna start by checking your capillary refill on your toes. Good, it's less than 3 seconds. Good circulation in the feet. Next, we're gonna perform the Babinski test, okay? So just lift your feet up for me, and I'll do the rest. All right, toes going forward is normal. We would note an abnormality if they went backwards or they flared out. So that's a negative Babinski test. Good. Next, I'm gonna feel some pulses. I'm gonna start by feeling, keep your pant legs up. I'm gonna feel the popliteal pulse bilaterally. Legs out a little bit. Thank you. They're about +2. I'm gonna check the dorsalis pedis pulses bilaterally. Ooh, those are +3, pretty loud. Next we'll do the posterior tibial pulses. And those are +2 bilaterally as well. Okay, do you have any problems with your legs, any soreness at all?
No, that's all.
They feel good? Okay, next we're gonna perform a Romberg test. So I'm gonna stand behind you and I'm gonna ask you to close your eyes and stand still for 20 seconds. Okay, good. Didn't lose your balance at all, that's good. Next we're gonna perform a get up and go test. So I'm gonna ask you to walk over there to that wall and then back to me, and I'm observing your gait. You feel well balanced, everything well? Okay, your gait looks good. And that'll end my assessment, Aaron. You're a healthy individual, and thank you for letting me perform that.
Have a wonderful day, doctor.
You too.